So we are discussing the antitussives group of drugs that are used for dry cough. We have already discussed the opioid group of drugs, in which we have discussed the standardized codeine drug, and we have also discussed the phalcodeine and ethyl morphine. These are the opioids antitussives. So other antitussives are, we have the non-opioids, then we have the antihistamines, and the drugs that act peripherally acting antitussives. Among the non-opioids, we have the drugs like noscapine, and then we have the drugs like dextromethorphan, and then we have one more drug is clofedianol. So these are the non-opioids group of drugs: noscapine, dextromethorphan, and clofedianol. So today we will be focusing on the non-opioid group of the antitussives. So let's talk about the non-opioids. First we will talk about the noscapine. So this noscapine is a opium alkaloid. It is an opium alkaloid, and this drug belongs to the benzo isoquinoline series. This noscapine belongs to benzoisoquinoline series, and it is an opium alkaloid. So what is the mechanism of action? That it acts on the central nervous system in the cough center, and as we know, most of the antitussives block the cough center present in the medulla oblongata. So noscapine blocks this cough center present in the medulla oblongata. Here, as we know, that most of the opioid groups of the antitussives, they have strong affinity with the mu receptors, as we know, but this noscapine has very weak affinity for this mu receptors. It binds very weakly. It binds weakly bind with the mu receptors which are present on the brain. So as a result of which, as we know, most of the opioids reduces the pain because of the strong affinity with the mu receptors, but this noscapine, since it binds very weakly with these mu receptors present in the central nervous system, so it does not reduce pain, and also it does not have any addiction forming properties. So it does not cause any addiction, and it does not reduces the pain also. However, the side effects like headache and nausea do occur with the use of noscapine. Headache and nausea do occur with noscapine. It is most of the time prescribed to treat whenever there occurs the spasmodic cough. When, for example, when the patient has, for example, asthmatic patients, when they have recurrent attacks of spasms, then this noscapine is very good drug for that. It is used for spasmodic cough. And it also has the properties where it causes the relaxation of the respiratory muscle, so it has a soothing effect on the muscle also. So it has a muscle relaxant property also. Muscle relaxation also. One more property with the noscapine is that noscapine reduces the cancer cell growth. So this property is under research, and it is now being researched for anti-cancer therapy, this noscapine. About the doses of noscapine, the noscapine is given at a dose of 15 to 30 mg. And comes, as we know, it comes in the form of syrup, as well as we have the tablets of noscapine. Here we can see the noscapine tablet of 25 mg, and also it comes in the form of syrup. For each 5 ml of the syrup of noscapine, it contains about 7 mg of noscapine, 7 mg. So this was about the noscapine, which is a non-opioid antitussive group of drug. So we are discussing the non-opioids. We have already discussed the non-opioids. In the non-opioids, we have discussed the noscapine, and now we will discuss the dextromethorphan, which is an antitussive. As we know, antitussives acts on the brain in the central nervous system, and as we know, in the central nervous system, in the medulla oblongata, we have the cough center. And this dextromethorphan drug blocks the cough center, and thus the initiation of cough reflex is not initiated, and the patient gets relief from the cough. And especially for dry cough, it is given this drug, this dextromethorphan. So besides the direct blockages of the cough center in the medulla oblongata, there are certain receptors which are also being blocked by these dextromethorphan, and these receptors are scattered throughout the central nervous system, and these are the receptors are called as the NMDA receptors. So dextromethorphan also blocks these receptors present in the central nervous system. So normally, what is the mechanism? How does the NMDA receptor works? So let's understand. Suppose this is the neuron, and in the neuron we have these receptors. These are the various receptors. are present on these neurons. These are the receptors called the NMDA receptors. NMDA receptors, and normally these receptors binds with glutamate. These receptors bind with, this is the glutamate molecule, glutamate. So whenever the glutamate binds with the NMDA receptors of the neurons, so what happens? There is the opening of the calcium channels. The calcium channels gets open and it enters the neurons. So there occurs the lot of calcium accumulation in the neuron. As a result, whenever the calcium gets accumulated inside the neurons, so there starts the excitatory impulse. So as a result of which the impulse starts spreading throughout the neuron, and these impulses then sent to the various systems of the respiratory tract for starting the cough reflux. So here the impulses reaches the respiratory tract for starting the cough reflex. So this is how the NMDA works. So this drug, whenever given, they block these receptors, these NMDA receptors, and because of which this excitation of these neurons does not take place, and as a result the impulses reaching for the cough is not reached, and as a result of which patient get relieved from the cough. But however, because of the high dosages, at high dose of these dextromethorphan, these NMDA blockages can lead to the decreased excitation of the central nervous system, and as a result of which the patient can have certain dissociative effects. As we know, dissociative effects are noted with this drug dextromethorphan, like a patient get detached from the environment, and had high doses of dextromethorphan, the patient can detach from the environment and also can have hallucinations. And this property is being used by many drug abusers with this drug of dextromethorphan. So the patient can have abuse this dextromethorphan because of his dissociative effects at high doses, because of the blockages of NMDA receptors with dextromethorphan. Besides these effects, dextromethorphan also causes certain side effects, like it can cause your drowsiness, dizziness, and even at high doses it can cause ataxia. These are the side effects I'm talking about with dextromethorphan. Patient can have ataxia, patient can have drowsiness, and patient can have also hallucinations with dextromethorphan. And about these dosages, the dose of dextromethorphan is 10 to 20 mg, and it comes as a syrup for as well as in the form of tablet. Here we can see 20 mg dextromethorphan tablet, and here we can see the 100 ml syrup of dextromethorphan. This dextromethorphan is also used in various cough formulations as an agent. It is used in various cough formulations. So it is comes as syrup form as well as the tablet form, and it is usually prescribed for dry cough. This is dextromethorphan. Now another drug is your non-opioid is clofidinol. So about this drug is centrally acting. As we know, it is an antitussive. It acts centrally acting drug, and it has slow onset as well as long duration of action. So its important properties: it has slow onset and long duration of action with clofidinol, long duration of action. And about the side effects with clofidinol, patient can have dry mouth with clofidinol, dry mouth. Patient can have vertigo and irritability with the use of clofidinol. And the dose of clofidinol is 20 to 40 mg. 20 to 40 mg. It is also comes in the form of Linctus. And the 5 ml of Linctus contains about 20 mg of your clofidinol. So this was about the non-opioids antitussives.